Over the last few days, you might have seen those headlines. Ozempic linked to suicide. New suicide warning on weight loss jabs. If you're on one of these medications, or someone you love is, that's a pretty confronting way to start your morning. I'm Dr. Chris Ho, a medical doctor in Australia, and in this short video, I want to walk you through exactly what the TGA, Therapeutic Goods Australia, said, and also what other therapeutic goods government organizations across the world has said, what the research actually shows, and how to think about this without panic and without conspiracy thinking. I'm not here to defend the TGA or attack it. I'm here to translate what they have written into plain language so that you can decide what it means for you. Let's start with the basics, the data, carefully, and then ask the question, what all this might mean for you? The TGA has now added a class-wide warning for this whole group of medicines: Ozempic, Wegovy, Sazanda, Trulicity, Mounjaro, about suicidal thoughts and behaviours. So across Australia and overseas, there have been reports of people on these drugs who develop suicidal ideation or suicidal related behaviour. In Australia, the database shows that dozens of reports of suicidal ideation and a small number of suicide attempts or deaths. But if you read the actual wording, it's more cautious than dramatic. So after reviewing all the data, the TGA says, no, there is not enough evidence to prove that these medicines cause suicidal thoughts. They emphasize that a causal link has not been established, even though the reports are serious enough, and that they want clinicians and patients to be aware and alert to this possibility. This mechanism we have is not a perfect system. It raises a red flag and there might be a problem, and then keep watching the data. We don't have to agree with every TGA decision, meaning we should neither dramatize or catastrophize or ignore a possible signal completely, which could become worse or better for that matter. So, what about the research so far? Some of the biggest studies we have are actually reassuring. Large US and European analysis of people taking semaglutide, the drug inside Ozempic and Wegovy, have not found a clear increase in suicidal thoughts compared with people on other diabetes or weight loss medications. The FDA in the United States, where the population of patients and consumers of this medication, has also said in its own review that it has not shown a definite link so far. At the same time, pharmacovigilance databases, the places where doctors and patients can report side effects, have picked up some reports of depression, anxiety, and suicidal ideation in people using this class of drugs. Those reports, yes, they are serious, but they are rare. So we are left with an uncomfortable mix. Very serious individual stories, but large population data sets that don't yet show a clear spike in suicide or self harm. When that happens, regulators usually do something quite unexciting. They tidy up the information, standardize the warning across the whole class, and remind everyone not to ignore changes in mental health while we keep watching for the evidence. That is essentially what has happened here recently. If you're taking Ozempic, Wegovy, Mounjaro, or something else, what does this mean for you personally? It does not mean this drug will make you suicidal. It does not mean you must stop this drug now. No. What it means is that your physical health and your mental health need to be watched together. If you already live with some depression or anxiety, that matters more. If your mood shifts after starting or increasing the dose, you become more flat, more hopeless, more unlike yourself. That matters too. But those are conversations for you and your own doctor who knows your bigger picture. This video is simply background so that that conversation can be calmer and clearer. People who are prescribed these drugs are not starting from a blank slate. Many carry years of stigma around weight, diabetes, fatigue, shame, and failed diets, all of which increase the background risk of depression and suicidal thoughts with or without any medication. Rapid weight loss and big changes in body shape can stir up old insecurities and tensions as well. So, when we see more mental health issues in this group, it can be tempting to point at the injection pen and say, that's the villain. Real life usually is more complicated than that. We also need to talk about conspiracy theories, conspiracy narratives, because they always appear. Whenever there's a new warning like this, two loud extremes jump in online. One says, see, Big Pharma have been hiding the truth. These are suicide drugs, and regulators are finally finding out. They've slipped up and they're finally admitting it. Or the other side, it says, this is all political and jealousy. Doctors and regulators are just trying to scare people off a good cure. Both of those are very tidy stories, and both are too simple to be actually helpful. The reality is slower and more ordinary. Regulators have seen rare but serious reports. They've looked at large studies. They've compared notes with each other from different countries, and they've decided to add a standard warning that mental health stays in the conversation, that people, doctors, patients become aware and stay alert to this possibility. That doesn't automatically prove a cover up. It doesn't prove a plot either. It simply means there is a risk there. So don't ignore your mood while you're on these medications. So, how do you hold this in your mind if you're considering one of these medications or already on one? Maybe like this. These medications can be life changing for some people, for blood sugar, for weight, and for heart risk. They also have real side effects, mostly digestive and sometimes involving other organs. Right now, the suicide risk signal is unclear. It is not serious enough that we should pretend it doesn't exist, but it is not strong enough to say that these drugs definitely cause it. Staying in the middle ground, avoiding the headlines, the drama, the hysteria takes more effort, but it is closer to the truth. I've no loyalty to any brand or agency. It is to you, a patient, carer, or a curious listener trying to make sense of the conflicting information that is around. If this kind of calm, down to earth explanation helps you, you're welcome to follow along. On this channel, I try to keep health information clear, simple, but not simplistic, especially around high profile treatments and topics of concern like this Ozempic and Mounjaro. In the meantime, take care of your body, take care of your mind, and if you're ever unsure, let your questions be a bridge to your own doctor, not a wall between you. Thank you for listening. Hope to see you again soon.